How we think, behave, perceive, and act always reflect the values we have imbibed from the community we have been raised in. Therefore, it is extremely important to be aware about the community we are thriving in and the ways to make it a better and happier place to live. A community is an inherent part of a day-to-day lifestyle which regulates general well-being and education of its members and provides support in adversity. Generally, a community can be defined as a group of people, although diverse, are linked by a common thread of geographical location, social draws, and standpoints. Although policies are made at state or national level, but the core intervention and prevention take place in a community. Therefore, any change begun at a community level requires that a community is assessed and surveyed periodically. The city of Kadeh is a passive community located in the east of the southernmost part of the Milwaukee County. The city of Kadeh was established around 1905. The city is enclosed by two neighborhoods, St. Francis and Oak Creek, and is bordered by Lake Michigan on the side and General Mitchell Airport on the other side. Therefore, although it is located around a commercial hub, it is still has the capability to provide a calm and family-oriented environment to the resident. There are several services available such as schools, general stores, sanitation services, social agencies, hospital and recreational centers, and health department. For safety, there are a fire department, fire hydrant, police station, frequent patrolling, sidewalks, stop lighting, and neighborhood watch program. Several activities for all ages such as child care, senior citizen center, recreation center called YMA, offering convenient classes and activities, martial arts center, a library, and several parks. Most houses are old and there are few new condos, mostly two-story and brick made. No mobile homes, lot of duplex and apartments. Houses are well maintained along with yard. Very few houses has a waste on the porches but no junk. The community is 65% Democrat and 29% Republican. There is a recreation center called Youth in Motion, YMA. There are several well-maintained parks such as Sheridan Park, Pulaski Park. There are a lot of trees and green spaces. There is a baseball field called Lattish Park. The overall air quality is good. The lake water is very clear. The city of Kadeh is a small community with a well feel of a very simple old town community. According to government profile, the estimate population of Kadeh is projected to be 18,202 in 2018. The population density is estimated to be around 3,833.6 person per square mile. The sex ratio is very balanced, with the female comprising 50.8% of the total population and median resident age is around 42 years. To be specific, the median age of males is 41.3 years and 43.7 years for females. Survey shows that foreign-born persons comprise 6% of the community and veterans are around 1,253. The demographic of the population is disproportionate, with white along comprising of 82.3% of the population. African American are 3% and Hispanic or Latino are 10.7%. Other ethnicities such as Asian and mixed races are around 3%. 10.8% of the population speak non-English language. Average people per household are 2.46, and there are a total of 7,434 households based on 2013 till 2017 survey. As compared to the state and nation, Kadeh has a great resident population of 65 years of age and older. Kadeh has a significant elderly population who unfortunately does not meet the recommended amount of physical activities in their daily life. They are also more likely to report high blood pressure, high cholesterol, diabetes, and heart condition. According to the survey, the top health risk factor in overall Kadeh population were high blood pressure, high blood cholesterol, and mental health issues. The mental health condition is on a continued rise and is more prevalent in males 22% as compared to females 8% in 2009. The mean age is 76.9 years, which is less than the state of Wisconsin 80.3 years and the US 78.7 years, indicating that the residents of Cudahy are not faring well in health maintenance. The trend shows that the heart disease and cancer are the leading cause of mortality in the city of Cudahy. There is a Aurora Sinai hospital which provides all the basic health services. Residents do not need to travel far for the services, as ambulance services and free community rides are available. If more services are required, then Fred Hospital is within reach, that is 20 minutes drive. In addition, Wheaton Francis Healthcare and Mental Health of American Wisconsin chapter provides direct clinical care services and health education in the area. There is a athletic or physical therapies available in Cudahy, which provides therapies related to physical activities. Also, Family Chiropractic and Blood Center of Wisconsin provide additional health education and support to the community. The Ascension Medical Group of Cudahy provides primary care in the community. Signify Health offers a network that provides mobile clinicians and the most sophisticated technology. Lakeshore Medical Group provides specialized and primary care providers under one group. Other than that, United Healthcare and Wheaton Franciscan Medical Group provide a vast array of healthcare providers in the community. One of the community partnership is with the clinic manager of Fresenius Medical Care at one of the locations. This includes connecting with bioengineering staff to get updated information on the technology and relaying that information to the clinical manager. The clinical manager then helps to connect with the Fresenius Dialysis Center in the city of Cudahy so that improvements can be made at these locations as well. Since the major stakeholder for this clinical project will be the Department of Health, Cudahy and elderly community, they can be the major resource in the community to spread awareness and education about the project. Another major resources would be a local dialysis center who can provide information about the current standards and procedures and number of patients suffering from the adverse effects of the procedure. The city of Cudahy has aging and senior citizen commissions who meet periodically to discuss the issues affecting the senior citizen community. The committee works toward advising the council and administration staff about the issues related to the gerontology and suggested measures to help. Cudahy Department of Health can be another major resource as they can provide information about the current policies and help in the formation of mandatory protocol for monitoring. Based on the trends, one of the diagnoses about the community health could be there is a risk of suffering morbidity and mortality due to hypertension and another complication in dialysis procedure among the elderly population of the Cudahy community. City of Cudahy has a significant elderly population and among them high blood pressure, heart pressure, diabetes and physical inactivity is the dominant cause of illness. Diabetes and high blood sugar are the leading cause of kidney failure, especially in the elderly population. In addition, Wisconsin has shown to have one of the highest rates of chronic kidney disease nationwide. According to 2016 Wisconsin Health Department data, Cudahy has had around 50% hospitalization rate among senior citizens. Majority of the total preventable hospitalization has been among senior citizens, 50%, where preventable includes diabetes and heart disease patients. Therefore, all this leads to the formation of a diagnosis. Objective is to implement a safer dialysis procedure in the community dialysis center in order to reduce procedure-related adverse effects and hospitalization of elderly patients, which would diminish financial and social burden on the community. The health plan would need a stepwise approach, choosing intervention using CritLine to increase monitoring and avoid volume discrepancies. Connect by creating a partnership with the clinical manager to initiate changes process. Education by gathering information for developers and engineering departments to educate themselves. Spreading awareness by contacting key resources such as senior citizen community and dialysis center. Implementation by a clinical manager for inclusion of gridline protocols. Evaluation by collecting surveys and hospitalization data to evaluate efficacy of change. The intervention would be to include gridline monitoring system during the dialysis procedure, especially for elderly patients with heart disease, in order to closely monitor their vitals and reduce occurrence of hypertension or other dialysis-related complications. People involved, such as clinical manager, nurses, technicians, patients, and stakeholders, can be notified of a new monitoring system by arranging a demonstration or education seminars from the experts in the field. Major form of the communication are newsletters, seminars, education pamphlets, briefs, and demonstration, including new research article on the subject. Evaluating the success or failure in numbers would also provide credibility to the project. An educational pamphlet in a layman language with a brief information would help community members to connect with the topic and understand the need for intervention. Educational material can be used to communicate with Senior Commission of Kadeh and Kadeh Health Department to gather support and spread awareness of the project. The stated goal can be measured by two ways, short-term and long-term. Short-term evaluation would include collect a sample small survey from the patients or nurses regarding the quality of procedure that day. Nurses can comment on how gridline monitoring helped them in determining an accurate clinical setting for the patients, and the patient can comment on the quality of care they received and amount of side effects they experienced 24 or 48 hours after the procedure. Long-term evaluation would measure the hospitalization rate of elderly patients or high-risk patients before or after the introduction of the gridline monitoring system. The data can be collected across all the dialysis clinics, including those who don't have monitoring systems, so that the efficacy can be determined with higher number of participants. The clinical project aims at introducing gridline monitoring during dialysis procedure for the elderly and patients suffering with chronic kidney failure. The aim is to introduce a better technology in a dialysis procedure which can benefit patients with chronic kidney disease. Introduction of this practice become more vital in the community because city of Kadeh has significantly elderly population, 18.3%, who is physically not faring well. Data reveal that Wisconsin has one of the highest prevalence of chronic kidney disease in USA. These factors make it even more important to continuously update the healthcare system in the neighborhood in order to reduce financial burden on the system and keeping the community healthy.